Latest on HIV cure. What's up guys, today let me give you current updates about the latest on HIV cure. If you are a new visitor, subscribe today so that you continue learning from our expert medical physicians. Actually, you will be delighted to hear that many research companies are steps ahead as far as developing a complete HIV cure is concerned. Few of the leading technologies include AmPhAR, American Gene Technologies, and so many others. Let me take you through what current HIV cure research aims to achieve. And note that clinical cure trials have already started now. You will know that HIV in our bodies targets and destroys T lymphocytes with two receptors called 1. CD4 receptors, 2. CCR5 receptors. HIV first attaches on CD4 receptors, and for infection to be successful, it again binds on the second receptors or CCR5. After attaching itself to T lymphocytes with the receptors mentioned above, HIV breaks into the T lymphocyte, or commonly known as CD4 cells, hijacks the cell, and uses the cell's resources to multiply itself into many copies capable of infecting other CD4 cells. Research has shown that there are very rare people who cannot get infected with HIV. Such people have a gene mutation on CCR5 receptors, which stops HIV from binding and breaking into the human CD4 cells. Current cure research aims to mimic the genetically mutated genes in CCR5 receptors. This is a summary of what state-of-art, or gene and cell therapy is doing in HIV cure laboratories. A patient will walk into the hospital and give about 400 ml of his or her blood, and then go back home. The blood will go into automated processes where HIV-specific cells are filtered out, have the genes edited and modified, and then after a couple of weeks, the patient is called back to receive his or her modified HIV-specific T lymphocytes. The modified CD4 cells are genetically engineered such that they are resistant to HIV infection. Some are modified such that HIV dies once it breaks inside. This will eventually give the patient what is called a HIV functional cure. In HIV functional cure, the patient will gain one or more of the following. 1. The virus is suppressed permanently such that it will not multiply in the body. The patient remains undetectable for life. This means there will be no spreading HIV through sex. 2. The virus is eliminated from the body. 3. The patient will not need daily doses of HIV medications and will live a life similar to HIV-negative people. No one actually ever dies of advanced HIV or AIDS. We are sure and optimistic that this is going to be very cheap because doctors will use the patient's blood to treat patients. No injections, no pills will be given to the patient. And what is interesting is that the procedure is likely to be done once in a lifetime. Hey, do you want to be the first person to be notified when this treatment is available, or get regular HIV cure updates? Subscribe today. Thanks for visiting Mark Medicals.